Hello, and welcome to the second learning objectives, where we are going to focus on care delivery and how that works under managed care. So, before we go into it, like I said, we're going to kind of focus on how managed care impacts patient outcome and provider practice. But before we go into it, I want to kind of define and explain some terms that you're going to hear or you may have already heard in this module, in this topic, because they are very, very integral to understanding how managed care work. So I'm going to start by, explaining what per member per month or pay patient pay month means. So what this is that there is a fixed payment model that providers receive every month, each month per the patients that are enrolled with them, regardless the number of services that they use. Not patients that are enrolled as much as patients that use the services that walk into the offices or they have some form of consultation with. There is a certain amount, there's a fixed amount of money they get paid. So if one patient uses one service, there's that amount is what the hospital or the provider is reimbursed for. And if one patient uses five services, the hospital is only reimbursed for one amount of money. So that is the amount of money that you get reimbursed, regardless of the number of services that a patient or an enrollee uses. So it's often used in capitation models for Medicare, Medicare Advantage, Medicaid, and insurance-based plans. So why did we come up, or why did they come up with pay member per month? And that's PMPM. What was the whole purpose of it, and what was it supposed to achieve? So with PMPM, there is a predictable cost to insurance and managed care organizations, because they have an idea of how much it is that they're going to reimburse providers for, because they know this is what is going to be. It's with if you're going to reimburse per service, it's a bit more complicated and a bit more unpredictable, because once for 1 month you may have very expensive services that is provided, and in the other month you have very low cost services that is provided. So it's a bit more unpredictable. But with the PMPM, it's more predictable, because insurance can have an idea of how much it is that they're reimbursing. So, what this does, the PMPM does, is that it encourages preventive care, because, like I said, more expensive treatments may require more referral, may require more, healthcare services or healthcare provision being a part of just this singular patient. So it's easier and much cheaper to offer preventive care than secondary care or tertiary care. So this way, in order to help the organization stay within budget, there is a they tend to kind of lean more towards preventive care, because it's cheaper, but also they know they'll get reimbursed for that. So this then helps reducing unnecessary procedures, because the focus then will be on effective care. What would get the most effective, so that you don't have like one patient needing five services when they could use one, because you get preventive care reduces the number of services that you end up needing, because it takes care of things before it becomes more complicated. So in that way, it does reduce unnecessary procedures to that sense. So, but there are a couple of challenges with PMPM, with all things. Um, PMPM kind of shifts the financial risk to providers, because if a patient uses, it requires expensive care, they will end up not being reimbursed for it, and therefore they will end up being the ones that are that covers the cost of that after they have because the managed care will not pay them outside of that. So but it also has the challenge of therefore providers limiting the services that they refer, patients for, because they know they will not be reimbursed for that. So in order to stay within budgets, even if a patient requires referral, they would know that this is going to take them substantially outside the budget, and knowing that they will not be refunded for it, they may not do that referral stages. So the focus wouldn't be based off on what a patient needs, but more within, are we going to get reimbursed for the service or not if we offer it to the patient. So another term you're going to hear in this course, and also associated with managed care, is prior authorization. So what prior authorization is that it's a cost control measure that requires health providers to get approval from insurance companies or managed care organizations before certain treatments can be covered. So they will not be able to give you a treatment or get prescribed a medication if there's no approval that is received for that. So it does help prevent unnecessary or low value procedures, in the sense that if knowing, let's use for example, knowing that the likelihood of it not being approved will make them kind of lean more towards things that they know the higher chances of it being approved is higher, rather than going for something that is not very necessary, that has a higher chance of being denied. And remember, the insurance companies or managed care organizations are interested in cutting cutting costs, but also I don't want to say cutting costs in a way that makes it sound like they don't want to spend money. It's a sense of cost containment, trying to keep the cost of healthcare as low as possibly can be, by with the prior authorization in place. So knowing that the providers, knowing that they're going to have to defend procedures, will kind of stay away from those unless they feel that this is completely necessary, and they can do that battle with the managed care organizations. So this way, it helps control the costs of of healthcare, because they would then do or prescribe or recommend or refer to cheaper, more effective alternatives than to more expensive one, or more those that haven't yet been proven to work, right? Because if it's innovative treatment and there hasn't been a lot of evidence of its effectiveness or its efficiency, they may not be able to get the prior authorization. So they will kind of lean more the cheaper, more effective alternatives than being more adventurous per se. So it does reduce over prescribing of expensive medication, because there's more of a push for generic medications rather than those name brands, especially if they are new in the market and there hasn't been a lot of clinical trials that shows that this is effective for this and this treatment. So prior authorization does have a couple of challenges to it. First is there's delay in patient care while your healthcare provider is, having this conversation with the managed care organization, having this conversation with insurance companies. The patient cannot receive a service until that approval comes, which means that there will be delay in services in terms of, being able to get that thing that you need at that time, because like I said, the provider cannot, go ahead with the treatment or the prescription or the procedure without it being approved, knowing that if they do so, they will not be reimbursed for it. So the patient has to wait until that approval comes about. So it does limit access to new and specialized treatments, which makes it very challenging for people who are faced with rare conditions that have not had a lot of clinical trials done on that condition. So there's a bigger challenge that any procedure, any medication, or any treatment is going to be approved as a result. The other term you're going to hear, or not, if not in this topic, but in as it regards to managed care in general, is pharmacy benefit managers. So PBMs, Sorry, there's so many acronyms in this. I'm kind of mixing it up. Anyway, PBMs are third party companies, and what they do, their job is to manage prescription drugs benefits for insurance. So they work with pharmacies and insurance to help control the cost of spending for medications and for prescriptions. So what they do is that they negotiate drug prices with pharmaceutical companies and try to get rebates from pharmaceutical companies for those drugs. And this often works with medications that are new in the market, and they're still kind of trying to pick up speed with the market. They will be able to cover rebates for that. Some of the times, when they are not, those medications are not covered by insurance companies, the manufacturers or the pharmacies may have rebates available for those, to make it easier for patients to get. So you are able to get those rebates through the pharmacy benefits managers. So they create formularies, which is a list of covered drugs, to help manage cost, which means that they are able to negotiate with pharmaceuticals in order to get some of their medications within, listed in those covered drugs, especially where there are, a lot of rebates for it. So it does help in managing cost. There are a couple of challenges with PBMs. First is that there is a lack of transparency in drug pricing, rebates distribution. Mostly patients who get to the pharmacy and want to pick up their prescription do not know of the existence of a rebate. So they may end up being asked to pay the full price, even though there is a rebate, allowed. So there's a bit of a pricing. There's a bit of a lack of transparency with that. Unless you are with, let's use for example, with a big pharmacy like Walgreens that have apps, and you see the prices, your out of pocket for each medication listed before you go and pick it up. You don't know how much your out of pocket payment for a medication is until you go to pick up your medication, and they tell you this is the cost that is due to you. So there's not a lot of transparency. There's no place that you can go and check the prices first before you go to pick up the medication. So there's a bit of lack of transparency with that. And then PMBs may tend to prioritize high profit drugs. Remember, they have a relationship with pharmaceutical companies, and they can get pharmaceutical companies to, the pharmaceutical companies can get their drugs listed in those the formularies. So they may be, a way of leaning more towards those high profit drugs rather than going with the best value options. So with patients, it can have a higher out-of-pocket cost for certain medications, especially when you combine that with the lack of transparency in drug pricing. Patients may end up paying a lot more for medications than they should. Another term you're going to hear, either as part of this course, or as part of managed care in general, is a Bill of Rights. So this is the set of laws that were made to protect patients that are enrolled in managed care plans. So the idea being, ensuring fair treatment, emergency access, and appeal rights. Fair treatment is in the sense that you're not going to have hidden costs, right? There is not going to be a situation where you are charged for things you are not aware of, and after the services have been provided, then they tell you have to pay for something. Meanwhile, there wasn't any conversations with you that this is the cost of this, and then suddenly you have a bill and you see a price that is completely new to you. But also another thing that it does is that it allows people to appeal bills. If there's a bill that comes to you and you don't agree with it, or you think there's something going on with this bill, you can actually appeal it. I had a situation like that. I think that was in 2022, where I was sent a bill for $200, and I looked at it, and the service that was listed to it, I was like, nope, nope, nope. This service was meant to be covered 100% because it was a preventive process. So why am I being charged $200 for it? And I appealed it using the patient bill of rights. And at the end of the day, that amount of money was covered, and I didn't have to pay for it anymore. So this is all part of what those laws does. So there are some key protections under the patient bill of rights. Part of it is that emergency care can be covered without prior authorization. So you don't have people waiting in the emergency care, waiting for prior authorization before services can be provided to them. It also gives patients rights to see specialists if it is medically necessary. The mechanism in which that happens can be a bit complicated, but you have that right. How to exercise it can be a bit challenging, but it's a right that exists for patients. And there is clear information on the costs of medications or costs of procedures or costs of treatment and the benefits that are associated with them. It does prohibit discrimination based off on pre-existing condition. A lot of that came with Affordable Care Act. So now that we're done with defining terms, let's get into how managed care has impacted patient outcome and provider practices. So, with patient outcome, with the way that managed care limits patient choices, and especially with the capitation model, there's a lot of focus on preventive care and access. Like I said, with the PMPM, patients are paid a flat fee. Sorry, providers are reimbursed a flat fee of fixed amount for per member or per patient. So they have an incentive to provide low cost preventive care, where you just provide like one service to a patient and having to wait until things get complicated, and then the patient is going to need 2 or 3 services for that. So it encourages preventive services like vaccination, screening, and chronic disease management. It also helps with care coordination, because this way it does reduce hospital readmissions and ER visits, because, like I said, there's a focus on preventive, before things escalate. But there are some challenges with that, with the way that's managed care does it in terms of patient outcomes. The first being there's restriction in terms of provider network. Like I mentioned, HMOs, Medicaid, and Medicare Advantages all have restrictions in terms of what provider you can use. If a provider is out of network, usually you're not able to use that provider, or rather, insurance will not cover it unless you pay out of pocket. So that restriction also limits patients' access to specialists, especially where you have to go through your primary care provider for referral, and they don't agree to do the referral. Like I said, because of the capitation model, they don't want to do that because they will only be paid for one patient, and things like that. So the cost saving measures that is under managed care can limit access to high cost drugs or procedures, unless your provider has to make a very strong argument for why they should use this drug or this procedure for you instead of a cheaper generic alternative. So, how does managed care affect providers? There is an incentive for efficiency because it encourages doctors to follow evidence based guidelines and meet quality benchmarks. Because, especially for procedures that require prior authorization, you have to make a good case. for why a procedure, a treatment, or medication is going to be approved for it. So having evidence-based guidelines and saying there's strong evidence for that, especially one that both the provider and the insurance is well aware of, it limits that time that will be spent in trying to argue for it. Is a bit more complicated if it's something that is still new in the market and you have to like make it really, really argue for it. But if there's evidence-based practice, evidence-based guidelines, usually prioritization doesn't have to be that complicated. So it kind of helps clinicians to kind of follow those guidelines, knowing there's a very, very high chance they would get the prioritization, or even a situation where prioritization is not required, they're going to get reimbursed for the service. For providers that are on computation models, they know, tend to focus on cost-effective care, knowing they don't want to spend more than over budget. But it does bring in administrative burdens because clinicians have to put in a lot of paperwork in order to go through the utilization reviews or performance reporting, just to kind of get through the bottleneck of getting reimbursed or getting prior authorization. So prior authorization creates a lot of delays and frustrations for both providers and for their patients. So but managed care does encourage a lot of collaboration between providers. When providers are trying to make a case for why a procedure is necessary, they can have a conversation with specialists, they can have a conversation with managed care, and they can all work together in terms of coming up with the best service for their patients. So there's a need. There's a push for collaboration. You're not working in a silo, since a lot of everybody is all facing the same difficulty, and you're not working separately. You're kind of having to collaborate with everybody and knowing how to navigate some of those difficulties. However, the managed care system does create a lot of ethical dilemmas, having for providers having to struggle between, do I go over budget knowing that I will not be reimbursed, or do I go with what the patient needs, even though it would mean us covering the cost of that because it will not be reimbursed. But there are some benefits to managed care with public health. There's a big focus on preventive care, like I've mentioned, regular checkups, screening, and then Medicaid managed care does help improve access to low income populations because they are within, you have that network lists, that list when they need services. It's easy to say this is the provider that you can go to, because managed care organizations usually have a list of the providers that are within network, so it does help with access. Care coordination through electronic health record, that's a good thing. One of the great things that managed care organizations has came up with. They didn't come up with it. There's a law that's made it possible, but it's been a very big push with managed care organizations. So it's been really good with care coordination. And because data is usually quite accessible within managed care organizations, it does help with big data analysis, and data analysts can help identify at-risk patients with using predictive modeling or using predictive medicine, because data is more easily available. So this is where we stop for the second learning objective. Just we come back for the final video. See you in a bit.